friends, it's Cara-Noelle. In my last video, we talked about all the options that I had been considering, dentures, snap-on dentures, implant-supported dentures, and then full fixed implants. And honestly, it took me a while to get to this decision because to me, it's not just a dental choice. It's medical, it's financial, and it's emotional. And it's permanent, right? But after a lot of research, consultations, multiple consultations, and some really honest conversations with myself, I decided to go ahead and move forward with full mouth dental implants. And I'm doing both the top and the bottom all at the same time. The reality of my dental history is that over the years, as I've shared with you guys, I've had multiple fillings, multiple root canals, crowns, and then those have turned into like retreatments. And even now, a lot of those crowns and root canals are again starting to fail. I've had teeth crack, which leads to like infections. And every time I went to the dentist, it just felt like I was fixing the next thing. And at some point, I just realized that I'm not fixing the problem anymore. I'm just managing this like slow decline. So what really changed my thinking was that, as I mentioned briefly at my last cleaning, they actually suggested doing a lower denture. And that was kind of the moment that everything really shifted for me. Not because dentures are bad, they help a lot of people. But for me personally, I just felt like I'm not even 50 yet. And if my top teeth are also crowned and heavily root canaled at this point, that realistically those will start failing too. So I had to ask myself a really hard question. Do I want to keep fixing these things one tooth at a time, or actually solve the whole problem? And the reason that I decided to go ahead and take care of, well, let me slow down. So why I chose implants, right? There were a few really big reasons. First, function. I want to be able to eat normally. I want stability. I don't want something removable. When I did talk about dentures, even the fixed implant dentures that like snap, pop on and off the implant studs, my dentist told me that when I was at home, she would suggest that I predominantly keep them out because of comfort. And that's just not something I was comfortable with. I don't want to walk around toothless predominantly. So there was that piece. So the second piece was like long-term health, chronic infections, repeated root canals, extractions. Those things take a toll on our bodies, right? And oral health is connected to overall health, heart health, inflammation, and just like overall wellness. So there was that piece too. And then third was confidence. This one is a little bit harder to say out loud, but it's true. When I make videos or post pictures, I'm thinking about my angles. I have felt like I can't really be fully present with my online presence previously or up till now because of that discomfort. I don't want to be on camera. It's very uncomfortable. Even these videos, I find myself like making sure that I'm trying to talk straight on, not tilt my head or look up or down too much because I'm self-conscious, right? So I think about how wide I'm opening my mouth. I think about what people can see. I watch things back and like nitpick it. And I don't know, but I assume that like with everything else, I'm my own worst critic, and maybe it's not as bad as I make it out to be or that I feel it to be. But it's just not how I want to live. So why I decided to do everything at once, because this was another big decision. I could have just done the bottom. I have all of my, well, I'm missing one top tooth. I did have an extraction of a molar actually a while ago. That wasn't even very recent, and that was for a different reason. But the reality is that my top teeth, I do have a couple of crowns. I actually had a crown fail the week of my consult with the office that I'm going with. But I also have a lot of root canals and I have fillings, and there are other teeth that are starting to need fillings on the top as well. So I just had to ask myself, do I want to go through the surgery now and then most likely have to go through it again, whether that's in a year, 2 years, 5 years, 10 years, whatever? Or do I just want it all handled at once, do it all at once, get it over with, and then be able to rebuild everything? And for me, that just made more sense, both emotionally, physically, financially. Just do it all at once, get it over with, and be able to move on and start living the way that I want to. And that kind of leads into the emotional side of this, because this decision does carry a lot of history for me. Bad choices when I was young, years where I couldn't afford care, embarrassment, regret, but also a lot of growth now because I have been sober for decades. I've rebuilt my health. I've lost over 100 pounds. And I feel like this is really like the next step in being able to take care of myself. So, like where I'm at right now, right? I've had my consultation, I've had my imaging, I've had my pre-op appointment, I've secured my financing. Um, and my next step is I still have to talk to the anesthesiologist. They call me, I believe it's about a week before the actual surgery. And surgery is scheduled. It's happening Friday the 20th. So only a couple weeks away. As I get closer, I'm nervous. I'm starting to prep because there is a period of time where I cannot eat afterwards. You're on a liquid diet for a few weeks, and then after the liquid diet, you go to soft solids. Um, there were also conversations I had around how this impacts my health journey because I'm used to working out 5, sometimes 6 days a week. And even honestly, on the days that I don't work out, I'm usually doing some sort of movement, whether it's a walk or doing some floor, like calisthenics workouts, working on core, things like that. So I do have some sort of, exercise movement that I try to do pretty much every day. So there were, conversations I wanted to have around that because the last time I had an extraction, I just had it at my dentist office, and they suggested, no working out at all for like 3 weeks, and that messed with my mental health a lot too, because when you're used to that consistency, losing that, it can just throw you for a loop. So this office actually suggested that I get up and start moving when I can. I just have to be careful, right? No heavy lifting, nothing strenuous. So within 3 days, I can start doing walking workouts again. And I chatted, I guess, or direct messaged one of my TikTok friends about some walking workouts that he does. And I've actually done a couple of them kind of leading up till now, just so I know what they're like, know what I'm getting into, know what to prepare for. I bought myself a nice resistant band with like handholds so I can do different resistance on the upper body with some of the walking workouts that this video series has. I talked about when I can start lifting weights again, because you have to be careful with the tensing and the gripping and the clenching of your teeth while you're healing. So I've just been going through all the prep, getting ready for like post-surgery, what that's going to look like, what I need to do, all that kind of stuff. So that's where I'm at. The journey is definitely scary, but it also feels like I'm finally addressing something that's been hanging over me for years. So if you're going through something similar, I hope that this series helps you feel less alone. And in my next video, I was thinking about talking about the office that I chose to work with, but they're not like a nationwide office. It's something, they have a couple of offices, literally a couple, 2 offices here locally to me. So I don't even know that that's necessarily important, like how I chose the office that I'm working with. I can talk a little bit about the consultations that I've had with like multiple offices maybe, or I don't know, maybe I'll just talk about the things that I'm doing to prepare, like more detailed, because again, with only being able to do like a liquid diet and being in perimenopause and being on this, wellness health journey, and wanting to not lose my progress and like the routine and the maintenance that I'm at right now, I've been doing a lot of research on protein drinks, clear protein drinks, protein shakes, things like that. And I've been just purchasing stuff and setting it aside for the time being. That way I have you know, multiple options to choose from so I don't get bored. Lots of different choices and options when it comes to textures and flavors and things like that. So maybe I'll talk about that next, actually. I don't know. I'll think about it, or you guys can let me know in the comments if you're interested in letting me know kind of what you would like me to talk about next. So that's it for today. I hope you guys all have a wonderful weekend. Thank you for watching, and I'll talk to you guys again soon. Like, subscribe, please. Thank you.